So the time is now 12:02. Again, thank you all so much for joining today's Public Health Discovery Seminar Series. My name is Cassietta Trewick. I go by Cassie. I'm one of the admission counselors here at the City of Sky Weatherhead School of Public Health and Tropical Medicine. And today I have the honor of introducing Dr. Valerie Paz-Soldan, who will be presenting her Public Health Discovery Seminar Series. And so take it away.
Thank you. Hello, everybody. My name is Valerie Paz-Soldan, as she mentioned, and I'm a faculty member at the School of Public Health and Tropical Medicine, specifically in tropical medicine and infectious disease. And I have been based in Peru for over 20 years, where I was born and raised. And I will be talking specifically about a new project that we're getting started on in the Peruvian Amazon that's called the Proyecto Tariki. I'll tell you a little bit more about that in a second. And it's about using evidence-based interventions for the reduction of dengue. So dengue, what is dengue? Dengue is the most rapidly increasing vector-borne disease in the world, in part because it's transmitted by a mosquito that's called Aedes aegypti or Aedes albopictus, but in Peru, mostly Aedes aegypti. And it's a mosquito that likes urban areas. And as we know, the population around the world is moving more and more towards urbanization. They're moving to urban areas where the mosquito thrives. So dengue is characterized, the disease is characterized by fever, pain in the bones or muscles, just the whole body aching, pain behind the eyes, which we call retroorbital pain, headaches. But interestingly, most people who get dengue actually have a very light case or clinically inapparent or asymptomatic. However, those people who have a light case, who may not even know they have dengue, continue on their day-to-day routine and may get mosquitoes infected and then continue the transmission in their communities. But so dengue often lasts 5 to 7 days. People feel uncomfortable. People have to stop working. Somebody has to take care of them. The deaths are about 25,000 deaths a year. For the 100 million cases that we have globally. But the ones that have what we call dengue shock syndrome or hemorrhagic cases are, about half a million of the population may have the more severe kind. So out of all the cases of dengue, usually about 10% may have stronger cases, and then 1% may have the dengue shock syndrome. So that's what's most associated with severity. And I just wanted to finish by saying that this Aedes mosquito in Peru, it's known as the pituco mosquito because it likes to hang out near people where it can easily get the blood that it needs to be able to have the nutrients it needs to produce eggs. So it's transmitted by a female mosquito. That female mosquito picks up dengue when she bites a person. So it's not that she's born with it. Very, very few cases. It can be passed within the mosquito, but it's mostly picked up from people. And there are 4 types of dengue, 4 serotypes. So you can get it up to 4 times. Once you've had each type, you won't get that one again. And here's an image of the mosquito. It has black and white legs. And that's one thing that makes it very characteristic. So for dengue prevention and control, vaccines. Are there vaccines? There are vaccines available. There are 2 that are now available, but they've been both very recently tested and brought to market. So they're not broadly available yet or broadly adopted. One of these vaccines, Qdenga, is being used in Peru, but not broadly. It's really focused on maybe trying to vaccinate younger people who have never had it before. And then there's another vaccine that's being used and tested in Brazil, the Butantan vaccine. There was a 3rd vaccine that was on the market for a while. But because a lot of times, once you have had dengue, your body creates this immune response to it. What was happening with the other vaccine was that it was acting as a first exposure. So your body creates immune response. That's what it's supposed to do. But then when they did get exposed, these people who were vaccinated, they were getting a more severe case because part of what is associated with the severity of the disease is having had a previous exposure and an overreaction, if you want to call it. It's called antibody-dependent enhancement. It's an overreaction of your body to this virus. So this other vaccine was taken off the market because it created more problems for people who had never had dengue than it was obviously supposed to. So as a result, dengue vaccines, yes, they're still in motion, they're still working, they're beginning to develop new ones, but it's still not widely available. And so really what we have to do to prevent this disease is vector control. And the vector control activities focus on two parts. One is making sure that there's no place for the mosquito to reproduce, these larval habitats where the mosquito likes to go lay its eggs. So part of that involves larval habitat elimination, reduction. That involves eliminating the sites where mosquitoes lay their eggs. And we can talk about like physical reduction, so eliminating containers that may carry water. Again, remember, this is a disease that happens in warm climates where it may rain, where there may be flooding, or where people may be storing water because they don't have access to regular water from a tap. So if you see in these pictures, you know, people have buckets, have pans. Sometimes there's a banana leaf or a coconut lying around that accumulates water, and it becomes an easy place for the mosquito to lay its eggs and become adult mosquito. So we have the teams in Peru, particularly the vector control teams. They come every 3 months and they look for these containers, and they also leave some like larvicide, like something to kill the larva and the pupa of the mosquito, or at least interrupt their reproductive cycle so that it doesn't become an adult. And they usually put this larvicide or the pyriproxyfen that affects the reproductive cycle in the larger like water tanks in a house, etc. So that permits, you know, it keeps the mosquito from the pupa or the larva to become a mosquito, an adult mosquito. Once you have adult mosquitoes, you have to deal with fumigation, or you have to find a way to reproduction. You've probably heard about Wolbachia. There's different strategies that are being used, not widespread necessarily yet, but that are being used to contain adult mosquitoes. But basically, you try to not wait till you have too many adult mosquitoes. And the question is this enough? Because we're still having a lot of dengue. And in fact, last year we had record numbers. We had a lot more dengue than usual. So one way to answer this question is to think about the life cycle of the mosquito. So I'm going to just briefly talk to you about this life cycle. The mosquito lays its eggs, and these are tiny little specks. I should have had a picture of this, but a tiny little speck that actually looks like just dirt on the bottom of like a container. It could be a wall, it could be a container, it could be a coconut, it could be between leaves in a plant that collects water, but it just looks like little specks. These eggs can last up to 6 months without water. They just have this hard shell. They survive there, which is why they're so easily transported from one continent or one country to the next. But once they're exposed to water, and that mosquito lays one egg at a time, and it lays an egg and attaches it to wherever, you know, maybe again, a container, and at an area where it's the water, the level of the water. So once these eggs become immersed in water, like it rains again, or you use that bucket that you were using that still had eggs that you didn't notice, you fill it up with water, these eggs, like the hard shell breaks open, and you start getting larvae. We have 4 stages of larva, and you can see here that from being an egg that's been sitting in a container for 2 months, 3 months, or even a week, you get larva, 4 days, and then it becomes pupa, where it looks like it's easier to see. But the problem with once it gets to the pupa stage is that it's about to become an adult mosquito, and we really want to stop that adult mosquito from happening. But if you look at this, we have 11 days, can be 10, can be 9, could be 12, could be 13, but we have about 10 days from beginning of this cycle to the end. And we were just talking about how larval habitat reduction is done in many countries where dengue is a problem every 3 months, every 2 months, every 1 month. In Iquitos, it's every 3 months. So if a person comes to check your outdoors, garden, any areas where water might like fall, or where you may collect water, or like in a bathroom where you might have a bucket with water, you come once every 3 months. If they leave and 2 or 3 days later, there's a big rain and some coconuts fell, or you toss them into the backyard, all of a sudden you have a new larval habitat. And even though there was a lot of surveillance from the team, it's not enough because that mosquito starts reproducing, right? So, and one of the important messages here is that it's kind of like a fire. You don't want to wait for the fire to really devour a house, because then it's much harder to control it. When the fire is limited to a pot, you can control it. Same thing happens with dengue. We really need to stop it early. Once the outbreak starts, it's really hard to contain. So thinking about this, we thought, okay, one of the reasons that these vector control strategies, they're every 3 months, they may not be enough. And this is part of the problem. So this is when we go to another kind of science that is known as implementation science, where you start looking at how are interventions being implemented? Are they being implemented the way they need to be implemented? Are they adoptable? Are they sustainable? But one of the key questions to us is when our interventions are not working, or not sufficiently working, why do we keep repeating them thinking that the result will change? And I'll tell you, change is very difficult in the system. So once a vector control team in a government has been doing a certain practice, they do not want to necessarily change it, because if there is a big outbreak that year, they will be fired because they didn't do their job well, when all they were trying to do was develop a new strategy or improve the strategy. There is a lot of turnover in these positions. So a lot of times somebody starts off trying to do something well, and there's a big outbreak, which is sometimes not in their control, and then they might lose their job. So that's why we keep repeating the same thing. Nobody wants to be the one who changes. And changing a system takes a lot of work. But the problem is that we're not getting a handle on dengue in our countries. So let me, so we came to this point, we've been doing interventions for all this time. We repeat it, but things are not changing. And so my colleague and I, who wrote this project, thought, we've been doing studies on dengue for 20 years in this region. We've looked at the role of human movement in the transmission of this pathogen. We've looked at different strategies for controlling dengue, like a spatial repellents. We've looked at that movement. We've looked at using GPS loggers to track people's movement. We have looked at knowledge that the people have about dengue. We have looked at the correct and consistent use of curtains that are treated with insecticide that people use in their houses. We've looked at the acceptability of feeding mosquitoes on individuals who have dengue, feeding them on healthy mosquitoes to see the transmission. We've looked at we looked at community-based rapid diagnostic tests. We've looked at all kinds of questions related to dengue, and I'm not going to read them all out, but we've done a lot. And so at one point, my colleague and I said, okay, we've been looking at dengue for 20 years. We have all this experience. With all that we know, what should we do? She's been living there for 25 years. We both have been working on dengue. If there's anyone who's going to figure out a way to address this issue, let's put our heads together and figure it out. And so we decided to take a look at the system, and I'm just going to explain some of the pictures. This is a person using one of our Procopacs, which is an aspirator. You'll see it in a later picture, but where we put the motor and a little plastic container at the lid with which we can collect mosquitoes and figure out what kind of mosquitoes they are. Here's one with a motor in the back. This, that kind of sucks, but here is a taxonomy. This is a colleague who's figuring out what kind of mosquitoes we've collected. We've been doing blood draws on cohort studies. These are the insecticide treated curtains inside a house. So as we set out to figure out what we should do, this colleague of mine and I, we decided to use a framework that I had helped develop as part of a project on cervical cancer. And it has 4 phases. And the first phase is to understand the problem, understand it well. The second phase is to find leverage within the system for change, figure out what alternatives we have. The third phase is to plan and implement, and the fourth phase is to evaluate and monitor what you're doing. And I like to use this example of the elephant because when we don't understand what we're dealing with, we might come up with wrong solutions for the problem. Here you have 6 blindfolded individuals who are touching different parts of the elephant. And one person may be touching the ears and saying it's a fan, or I like to say it's a bat. I'm dealing with a bat. Another person is touching the tusks and is saying I'm dealing with a spear. Another one the tail, and it may be saying I'm dealing with a snake, a wall, whatever it is that they're touching. And so I ask you, if you think you have a bat in your room right now, like what would you do to trap it? I suspect you might get a butterfly net and maybe try to catch that bat. If you thought you had a snake in your room, you might not use the bat net. You might use like a broom or a long stick to kind of push it out. So depending on what you think is the problem, you will develop a strategy to solve that problem. If you know you have an elephant in your room, it's no longer a bat, it's no longer a snake, and you no longer use a stick, right? So we cannot continue to develop solutions and interventions without truly understanding what are we dealing with. So as part of understanding the problem, she and I sat down to think of like, what is going on with the system? And we mapped it out, we drew it out. We thought helping to make it very visual helps people understand this problem. And so we looked at, and I'm not going to go into all the details of this slide, but we looked at how the system is organized, and we have vector control teams that inspect 20 to 22 houses a day. That means that they can, based on the numbers that they have, they can only reach about the house once every 3 months. They're organized very hierarchically. They go to the community. When they start finding, cases or mosquitoes, they might fumigate. So the fumigation is triggered. It's not constant. It's only done usually once a year or one time of year. And it's triggered by data that's showing that we're beginning to get a lot of adult mosquitoes or we're beginning to get cases. Data is managed into entomological data, the mosquito data, epidemiological data is in an epi lab. We also have fever data that's coming in through health facilities where we start knowing that there's like fever cases. But the bottom line is that there are a lot of barriers. First of all, there's a lot of turnover. They always run out of money. And larviciding is not driven by coverage of risky households or risky locations, but rather it's just done everywhere at the same time. Barriers are spraying. The spraying happens at 5 in the morning when there's a better likelihood of finding the Aedes aegypti mosquito flying around, and also like at a time of day where the fumigant, the insecticide won't just vaporize away. But that means that somebody comes to your house at 5 in the morning, and even though they're supposed to be preceded by a team that says, hey, by the way, tomorrow we're going to be fumigating, what a lot of people in the community report is they come banging on my door at 5 in the morning, fumigation, get out of your houses. And so at 5 in the morning, you're woken up and told to leave your house for the next 4 hours before you've gone to work, before you've taken your children to work, before you're ready to evacuate your house for the next 4 hours. So a lot of times people don't want to be doing that, and they don't understand that it's fumigation at that time because there's a reason. And then there are other barriers in the health system. Just to give a few is data is unreliable. It's not used very well in practice. Doctors are not testing for dengue. A lot of times it's a syndromic management where you see fever cases, you start describing body ache, et cetera, and they say, okay, we're starting to see dengue. And then I test the first 5, 10 cases, realize, okay, dengue is going up, and anyone who comes in with those symptoms may be categorized as a dengue case, even though they haven't really been diagnosed through testing. Which means that sometimes you can also get confused, right? You might, like this past summer or 2 summers ago, there was an Oropouche outbreak, and they thought it was dengue because it had a lot of similar symptoms, but actually it was a whole new virus, a whole new disease that they were dealing with. So we visualized the data, we understood the problem, we thought, okay, what do we do? Again, we've worked on this for 20 years. We have all this data. We've all this experience. We have all these insights. We've done focus group surveys, cohort studies. What should we do? And that's how the Tariki project was born. Now, Tariki means I found you in Quechua, te encontré, which is why we gave it this name. And it's a project that really focuses on involving the community for the prevention and control of dengue and mosquitoes. And if you remember what I was saying about the Aedes life cycle, You cannot contain 80s if you're checking for containers every 3 months. It needs to be done every week because of the life cycle, which lasts every 10 days. If you're not on it every week to look for that, for larva or pupa, you're going to miss out. It's a collaboration between Tulane, myself, a colleague in UC Davis, Amy Morrison, and two colleagues at Berkeley, James Holston and Josefina Coloma, who had done a project that mobilized communities and used an app in Nicaragua, and that has now been used as evidence for our project. So Peru is located in the western side of South America, and all the area here in green is rainforest. And here's Loreto, here's Iquitos. Iquitos is a city of about 400,000 people. But if you look at this extensive area, you just need to understand that Iquitos is the largest city in the world that you cannot reach by car. There's no way to drive to Iquitos because the only way to get in there is either by boats or by airplane. And if you look at this entire state, there's 100 kilometers worth of a road right here of a large avenue. The city is big and it has paved roads, but most of this area is only rivers. So there's no car travel, there's no ambulance travel. It's all by boat. And in the health facilities in the deeper parts of the rainforest, what you will find in a health facility is actually a boat motor, because if there is an emergency, a woman is giving birth and the baby can't come out, if there's an emergency, they literally put the motor on the boat and transport that person to Iquitos. But if you live around here, it may be 2 or 3 days worth of travel. So the situation is very complex and difficult. But our project takes place in Iquitos, by what I told you just a few minutes ago, which is that this mosquito really likes urban sites. So we designed our project, and we use the same thinking that we did to map out the problems in the system to decide what are the things that we need to change in the system. One of them was, we cannot just depend on surveillance teams. We need more constant effort. And this is where that project in Nicaragua helped us to kind of think of ways to organize communities. So what the first pillar, and I will go into more detail with these, but the first pillar is about community mobilization to do surveillance and elimination of these larval habitats. So we proposed that we were going to form brigades, volunteers in each community, and each community volunteer would have 10 houses that they're in charge of, and they would check those houses. And then it wasn't just I would check those houses, but that volunteer is in charge of going to those 10 houses every week and training and educating the person who owns that house on what they're looking for, what they need to be looking for. So it was kind of like a cascade effect. We would train these volunteers, the volunteers then train their community, and little by little, our role in that community needs to go down because we move on to another community and they keep the knowledge and experience of what they're doing. So that's one of the pillars. The second pillar is febrile surveillance. As I mentioned, like if we can capture early cases early on, we can try to eliminate, we can try to reduce dengue as it's beginning to spike up instead of waiting for us to have a fire that's out of control. And for that, we have different ideas. I'll mention some in a little bit, but we have different ideas. And the third pillar is evaluation. So right now we collect all this data, but then the data gets stuck like in somebody's computer, somebody's office. It's not always well collected data. And sometimes there are interventions and people think they don't work or they don't work very well, but we don't really know because appropriate evaluations are not being done. And, it's kind of like writing a paper for a class and not getting any feedback and not being able to improve your writing because you never get any feedback. The whole point of getting feedback is that you start improving the depth of your thinking, the quality of your writing. And that's the whole point of evaluation is let's look at what's working in the system, what's not working, what should we try again, what should we try differently. So those were the three pillars that we discussed. And so let me talk about each one. So community mobilization and empowerment. We decided we were going to focus specifically on the life cycle. We wanted to make sure that everyone in the community understands why they need to check their houses every 10 days or every week. Checking once a month is not enough. You really need to be on it. We wanted to build local expertise. Once we train the volunteers and once the volunteers take that knowledge to their communities, everybody knows what they're looking for. Everyone knows where to look, right? And we also said it's really important for people to get feedback. You're checking week after week, like we need to tell you you're doing a good job, or the numbers of mosquitoes that we're finding are lower. Because it's hard to keep on with behaviors. One is when you say, hey, you're rewarded, you're doing really well. The other thing is sometimes also being able to know that certain behaviors are hard to keep on all the time. We noticed during COVID, we got the red light, the yellow light, the green light. And sometimes like when dengue is exploding in the city, you need to be on it. And at other times, you may be a little more relaxed, right? So, and these are typical yards in the people's houses in Iquitos. The houses are often long and thin. And in the back of the houses, they have like where water comes in. They have their kitchens, so that when it's, you know, a lot of times are cooking with wood or coal. So the fuel, like they do it outside so it doesn't get smoke in their houses. But you see that there's a lot of like items lying around. Look at this little bucket, look at the leaves, look at these containers. And the roofs are not necessarily waterproof per se, so water can come in. And so sometimes these containers are containers. Sometimes the containers are literally a little puddle that forms inside their house because water goes through. And we find larvae there. So the second part of our pillar, as I mentioned, was the febrile surveillance for a rapid response. We want to respond quickly. We have several strategies, and this is the whole part where you talk to your stakeholders, your experts, and you say, okay, there's different things we can do, and maybe we do one thing in one community and a different thing in a different community. One possibility, if you're looking for people with fever, is to start contacting the professionals working in these health facilities and asking them for data. Like when you start seeing cases of feverils, or when we start seeing an increase in number of fevers, like we need to know. Now they usually report to the epidemiology unit, so we can ask them for the data. But one way is just to find out. And if we start seeing that there's a lot of fever increasing in one community, we can go specifically to that community, you know, and find out what it is, or start trying to diagnose. We also have rapid diagnostic tests, kind of like what we did for COVID, where you can test people for dengue, and we can apply these in the community. And so Amy and I have already done several, Dr. Morrison, sorry, and I have already done several projects where we see if community can learn how to use these rapid diagnostic tests, and that's a possibility. Or another possibility is to use this at a health facility. So as soon as we start seeing that fevers are increasing, we ask them, can you apply here some rapid tests we're going to leave behind, test some of these febrile cases, so we start seeing when dengue is beginning to go up, right? And again, the other possibility is this is a typical community. You know, this is, you know, maybe we have a volunteer in this community who since we're going to be using information to record what's going on in the houses with regard to the mosquitoes, maybe we can have that same volunteer also start notifying us when there's a lot of fever cases in their communities. So there's different strategies that we can use. And it's a question, and in some communities, one strategy may be better than another, and that is something we work out with the communities. But this is the kind of data that we start seeing for like febrile surveillance and dengue in Iquitos, and this is old data, but it gives you a sense of what happens. And here you see that we have certain months where we get bigger peaks for dengue. It's every 2 months. So usually between January and April is usually like larger peaks, but because that's when the river's water is high. But you see that here we had dengue 3, the next year we had dengue 3, the next year we had dengue 3, the next year we had dengue 3. And then boom, this yellow one came in, dengue 4 came in. One thing we see, at least in Iquitos, is that often one serotype, when it comes in, it displaces the previous one. So we see that dengue 4 came in here. And then in 2011, we see this peak. You can't even see it on this graphic because we had a massive outbreak of dengue 2, and it was quite severe. So the hospital became overwhelmed. There were 20,000 people who got dengue. The hospital had like camped tents outside because they couldn't have enough control for the cases. So what we're trying to do is, if you fumigate early before it gets out of control, you can hopefully like create a little downward surge, and that alone will keep it till the next season, if you know what I mean. Like you already see that this is seasonal. Like it goes down as the weather changes, like it goes down. So if you can kill the upsurge when at the right moment, you can prevent an outbreak. So that's usually when we try to fumigate. But anyway. And the third pillar is the evaluation, as I said, evaluation. We need to use data to inform decisions. We need to use data to empower communities. We need to use data to let them know how they're doing. It's the feedback. And we need to be able to communicate these findings to the communities and document what's going on in the communities because it's always changing. Let me give you an example. A lot of times we talk to people about manually filled containers. What's a manually filled container? It's that bucket in your backyard so that when you don't have water later that day, you can wash your dishes. It's that water tank from which you drink your water. And a lot of times, the focus of a lot of larviciding is on those containers. They're these big containers everybody has. But there are other kinds of containers that we're watching for. There's actively rain-filled containers. What does that mean? It's containers that you say, oh, shoot, it's going to rain. Let's put buckets out there and collect our own water. That way we don't have to pay for the water, right? So they're actively rain-filled. I'm putting them out there because I want to fill them up with rainwater so that I have water. And there's also passive rain-filled containers. What are those? Those are containers that, like, when it rains, they get filled up with rainwater, but not on purpose. They just happen to fill up because you have a little Coca-Cola lid in your backyard, or because you have this banana leaf that accumulates water. And if you look at the city, we're focused on these yellow, the manually filled containers. But if you look at the city, you see that, like, actually it's the passive rain-filled and active rain-filled containers that are the biggest problems. So it tells you, let's change our strategy. Let's try something different. Let's focus on some of those rain-filled containers. Here's another example. We had insecticide-treated curtains. So these curtains were treated with insecticides, and the idea is that the mosquito would stand on them. It's a daytime biting mosquito, so we don't need it as a mosquito net. We need it where people are during the day. So we put these curtains around, and most people don't have all the doors they need or the walls they need. So they use them as kind of screens or doors, or and so they put these insecticide-treated curtains, which they thought were pretty, around their house. And the idea is that the adult mosquito lands on it, sits on it for a bit, and dies. Great. And, it doesn't require a lot of behavior change from people. They just put it up. They think it looks pretty. I thought this is going to work really well. So we did focus groups after 6 months. So focus groups just sat down with people in the community and started asking, how is it going with the curtain? What do you like about it? What do you not like about him? And people started saying, the first 3 months they worked great. I could see mosquitoes on the floor of my mosquitoes on the floor of my house or underneath the mosquito. I saw spiders, I saw cockroaches, I saw all kind of dead insects. It was working great. But after 4 or 5 months, I don't see the same thing. So we thought, that's strange. So we thought the first response from the people who develop these curtains and make them is like, oh, they're using them incorrectly. They're probably washing them with soap, and they're not supposed to wash them with soap, and they're probably hanging them out in the direct sunlight. They're not supposed to do that. Well, we also had some curtains set up in some of our own control sites in our office, etc. We started testing those with this procedure that, it's called knockout, where you put some mosquitoes and you see how many of them knock down after a certain amount of time. And we saw that sure enough, it wasn't working very well. And so what it turned out is that we had to reimpregnate these curtains with the chemical, and it didn't work very well. So next, so that was that. Then the next step was to find leverage within the system. Well, we were talking about finding leverage within the system. When we're talking about finding leverage, we're talking about what works, discussing with stakeholders. This is the reality of Iquitos. Iquitos is a place without cars, because I told you can't get there. The boats are done in the buses are constructed on site. Sorry, I'm just going to say no calls. Yeah, sorry. The buses are constructed on site because you can only bring in the chassis on a river, and it's mostly moto taxis. We need to find an implementation, an intervention that is feasible for the setting, that's appropriate, culturally appropriate, that is adoptable and sustainable in this setting, that's cost effective. Like they're not going to invest in a lot of money when there's not a lot of money. And that once you finish this trial, that we can stay faithful to it. We do it the way it was designed to do, and that the coverage is ample. So as part of the study, we started collecting data early on. You see us here looking at larval habitats. We see them arriving with the containers with which we collect some mosquitoes. We see this person with a Procopac with which we aspirate adult mosquitoes, and we see them looking through different types of containers. We also collected survey data, and now we're in the phase of starting to plan and implement. For that, we have created neighborhood maps. We've started identifying community organizations that could help us. We've started engaging the communities. We've started identifying potential volunteers, and we also have an app that is going to be used for us to collect data and document data and be able to report back to the communities. And again, I've already used. We designed what's called a step wedge trial because we are going to be starting in one community, and then we use all of this as a control, but we're going to be gradually expanding. If you look at the fuchsia and where my mouse is, you will see that we will start growing, where we started at 13 to 18 months, then at 19 to 24 months, we'll add some more communities. At the third year, we're going to add more communities, and slowly until we end at year 4 with a lot of these communities in fuchsia, because we've intervened there with some control, and we can control the communities with each other, and that allows us to do the study that we want to do. And we are also talking to as part of that evaluation element, we're talking to stakeholders at the regional health authorities, how to do these kinds of trials, how to do step wedge trials, so that as they do any intervention, they have the tools to evaluate their own work. So here we've mapped out these communities. These are communities that we're starting in. And we really had to create, with QGIS, we had to create like specific maps. You see how long and skinny these houses are, but we need to have these maps because as we form community volunteers, we need to be able to assign them houses, and we need to assign them 10 houses, and we need to be able to visualize where they're going to be working and where one house has become 2 houses and how you access these different houses. So you see the work that's been done ahead of time. We're not doing this like, okay, volunteers, go out there and do this. We really have to assign houses, tag these houses so that when we start entering data, we know which houses are getting checked and which houses are not. So this is part of that preliminary work. We've created this chat, this Dengue chat app. This Dengue chat app is in development, but what it does is that when the volunteers will be able to download this app, and what we've heard from our peers in Nicaragua is that a lot of kids really got into the project because they could use this app to check, to put data, and they really liked feeling trained in like apps and informatics. And so they'll go into houses and check how many containers they found, what they found in these containers. And little by little, we'll be able to say, these houses are at high risk because we always find containers, and we always find adult mosquitoes or larval habitats, or these houses are at less risk. And this data all comes into our computer, so we can also track locations over time, see where data is not being collected on the app, etc. But it gives us the information that we need to then communicate this back to the communities. And this, as I say, is in process. In addition to the volunteers, we have our own entomological staff that will be going to these communities, so we can also double check quality control, check the work that's being done, and do a more thorough, like the volunteers are not going to be collecting adult mosquitoes. They're going to be looking for larval habitats. But if we're doing a good job at controlling the larval habitats, we should have no adult mosquitoes, right? Meanwhile, our teams will do a much more thorough search where they'll look for larval habitats and adult mosquitoes with those Procopacs that you saw. So we've started having community meetings, and we're really excited about that. These are 2 of our key team members, Alfonso and Jenny. Here we are at a community meeting where we actually took pupa. Here we have the eggs. Then you see pupa larva, and we had the kids like differentiate what was pupa and what was larva by using the pipette to put them in different containers. They got really into this. Here you see the side, these are papers with eggs on them, so you can see how tiny they are. And then we had adult mosquitoes, so they could see what they were looking at and what they needed to be looked for. And here is one of the meetings that we had in a community on the 14th of February. And in these meetings, we told them what we want to do, what's the objective of the study, but we also said, we're going to need their help. We want to mobilize. We need your help. We need to get volunteers. And we took pictures of some of the work that we'd done preliminary. And, when the kids see their picture, they're like, that's neat, that's neat. They get excited about maybe being a volunteer in the community and seeing themselves reflected in this work that's going to be, a community unifying strategy, because it's not only dengue. Eventually, like in Nicaragua, they started doing community theater. They started doing rap songs. They really turned it into whatever they wanted it to be. So it's a really great, you put the seed, and then you see what crops, what flowers out of that seed. And each community will have different strategies or interventions or way it grows. So here we see them doing surveys. We see them like interviewing people. So we shared with them some of the preliminary data we found in very simple ways. For example, here we showed them that out of all the houses that were visited, and I forgot what the denominator was at this point, but out of all the houses that were visited, 1 out of 10, 11%, but 1 out of 10 had larval habitats. And out of all the houses that were visited, about 52% had Aedes adults. So that meant that, like, on average of 2 adult mosquitoes in each one of the houses in your community. It gives you an idea. There's a lot of these adult mosquitoes flying around. This is not good for your community, I also want to show you this short video that shows you how this works. You see the motor, you see the container, and you see how the mosquitoes get sucked into that mesh. They get sucked into that mesh, and you keep the motor on, then you put a lid on it so that you can then take them to the office. You take off that lid, and you go to the office, and you can then do taxonomy. In the cap, we found that most people do not know about the mosquito life cycle, despite the fact that they've lived with dengue for many years. I'm coming to the end of this presentation because basically we are also reporting what we're going to be doing to measure how well our project works. We have indicators to say, did we meet the processes that we wanted to meet? Did we meet the impact indicators, the outcomes that we wanted to see? And we're using, again, an implementation science framework to say, okay, we're going to look at the coverage. What was the reach of our program? How many houses did we get to? What was the effectiveness? Like, what do we see? What interventions? How much adoption is there? Do we see that the regional Ministry of Health takes over this project as we start going away? How do we get them involved? We're using mixed methods, qualitative and quantitative, to assess how well this project works and the sustainability of the project. We want to see that this works. I don't want to spend 5 years of my life to create something that dies the minute the funding is gone. And just to end this presentation, I want to show you 2 screenshots from our office in Iquitos. You can see we're right on the river that goes into the Amazon River, which is an hour downstream. Not even an hour, but it's downstream. You will see that even the school buses are like these boats painted yellow. And you will see the drawing of a kid who has already written the IED's life cycle. And we started getting kids involved by drawing. This work is the work of a lot of really great people. Here we have my colleague, Amy Morrison, who's lived in Iquitos for 25 years. Jacob, who's a doctoral student, who's beginning to work at this project, who's the project coordinator. This is literally outside our door in our office. There's a big market that's formed. And here we have birds, and we were talking about this is bird flu, and so here we have our entomology team. This is our colleague from Nicaragua who came, and this is our team in Iquitos. And one thing that I always finish my presentations with is, if you want to go fast, go alone. But if you really want to make a difference, if you want to change the system, if you want to have an impact because it's sustained, you go accompanied. You work together, and it goes slower, but you can go further, right? So that's the end of my presentation. I don't know if there's space for questions and answers, or if that's the end.
Yeah, so thank you so much, Dr. Paz-Soldan, for your public health discovery seminar series. At this time, if you have any questions, please drop them in the Q&A chat. We welcome them.
In the meantime, I just will tell you that there's a lot of exciting work going on, and I know that this is an undergraduate population, so you should look into what your different professors are doing and find out about these activities. This is the whole point of your education is to like explore different areas that you can get involved with. It's about discovering that there's fields that you never heard of. So, you know, if you thought you were going to go in to study this, you know, there may be a lot of things that you have not even heard of and that you might want to explore. So, you know, I don't know how many of you have heard of entomology. I don't know how many of you have heard of these infectious diseases, et cetera. So explore different opportunities because you might don't know where that passion will be found.
Thank you so much. I love that advice. I really do. Um, so please feel free to drop your questions in the Q&A chat.
The rainforest is a very interesting place to go explore. It's not, you know, again, Iquitos is a city of 400,000 people. So it is a city, you know, it's like with roads, etc. But it's in the middle of the Amazon. I mean, it's incredible. Maybe we should come to an end.
Well, if we don't have any more, if we don't have any questions, I'm going to give you back a little bit of your time. Again, thank you all so much for joining today's Public Health Discovery Seminar Series. Thank you so much, Dr. Paz-Soldan, for your lovely Public Health Discovery Seminar Series. And please tune in. We do have other faculty that are going to present for their seminar series as well. But again, thank you all so much, and you all have a wonderful day.
Thank you. Bye-bye.